Welcome to our session on predictors of medication alternative cost-saving strategy among adults with type 2 diabetes. I will now turn things over to our presenter.
Good morning, everyone. My name is Dr. Olaseni Solomon Oduwaye. I would like to present to you this morning present my completed research study, the predictors of medication alternative cost-saving strategies among adults with type 2 diabetes. Next screen, please. As in all other research studies, the problem statement for the study is that utilization of alternative medication cost-saving strategies is a concern resulting from financial burden. And this has been a problem created by prescription medication cost-related access barriers, including lack of insurance, maybe underinsured or low income among adults with type 2 diabetes, and it makes it difficult to comply with their medication regimens. So having noted these health implications of using the medication alternative medication cost-saving strategies. So this study, the purpose of this study, determine if the participants' monthly out-of-pocket expenses, the monthly number of prescribed medication, and health insurance status actually predict participants' self-reported utilization of medication alternative cost-saving strategies that is defined in this study as the untraceable claim, which is not trackable claim source of prescription medication in the CMS claim or pharmaceutical beneficiary claim. From that include obtaining sample from physicians, splitting pills, purchase medication from another country, and purchase from the internet that we are using to reduce cost in managing their chronic conditions. At the same time, the study control for participants' socioeconomic and demographic factors. Those are the study score variables. The significance of the study is significant in that it helps to manage a service cost. Type 2 diabetes adults use alternative in order to manage their health service cost. Type 2 diabetic adults use alternative source for prescription drug that help drug cost-related access issues, as mentioned earlier. The study then examined a gap in the current literature that is contributing to the understanding of the predictors of medication alternative cost-saving strategies usage among adults with type 2 diabetes. The study used a theoretical framework known as the reason action approach model, which combined the theory of the planned behavior and the theory of reason action. So the theory predicted behavior based on the human attitude, subjective norm, and the number of and perceived behavioral control, which combine the attitude and subjective norm, So this theory may have helped explain the intention prediction for using an alternative cost-saving strategy. Next, please. So the relevant scholarship, those are evidences that lead to the gap that I try to exploit in this study. The evidence have shown that overall, 44.7% of US adult residents have reported purchasing medication online in other countries, and those that reported or doing so for cost consideration. At the same time, the evidence also suggests that among 37.9% who did so for other reasons, 53.5% did so at their employer or healthcare provider's direction. Also, between 2017 to 2018, 26.3% of adults aged 18 to 64 diagnosed with diabetes in the US than those over 65. 21.9% asked their doctor for a lower cost prescription drug and were willing to use other alternative strategies. On average, adults with diabetes takes at least one or more prescribed medication. And over 65 years and above are those covered by Medicare supplement per day that resulted in enormous out-of-pocket expenses. So that is causing another significant financial burden. So those evidences suggested that using an untrackable alternative medication cost-saving strategies is associated with medication non-compliance among the Medicare supplement population. However, none of the studies examine the untraceable claim of alternative source of prescription medication and predictors while controlling for socio-economics and demographic. This is the basis of this study, the gap explored for this study. Next, please. So as in any other study, having understand the problem and in the problem, there comes the research question. I already understand the problem and the gap. Now, the research question in this study is that was developed to examine the association between the independent variable of interest and 4 separately measured dependent variables. The independent variable of interest is mainly the out-of-pocket expenses, number of prescribed medication, and health insurance status, which is known to cause which was attributed to this financial burden, and 4 separately measured dependent variables that include purchase medication over the internet, purchase medication from other countries, and obtain from doctors or patient assistance program, and split pills or change dosage frequency. Those dependent variables are defined as alternative medication cost saving strategies in this study, while controlling for patient socioeconomics and demographic. The procedures in the study was a cross-sectional patient self-reported survey design and administered online on the Qualtrics platform. The questionnaire was captured in the validated consumer assessment, health and providers survey of 2018, and then modify the questions to examine the study variables relationship. Those are the association of the independent variables with the dependent variables. To the participants in this study were Amazon Mechanical Turk Crowdsourcing Marketplace, known as MTurk members. The inclusion criteria is that an MTurk member must be a US resident, an adult with self-reported type 2 diagnosis who had used a prescription medication in the last 12 months. The strategy here is that the participants, the study was restricted to the US. So those to the US members of the MTurk. So those ones that meet the criteria were selected for the, those ones that met the response, and the criteria were then selected for the final analysis. And the final analysis was 395 participants' responses who met the study requirements. So actually, we have more. I have more than that response, but in most cases, due to missing data and all, I excluded a lot of them, and then just arrive at the 395 participants who actually met all the requirements. Though I conducted my data analysis based on this 395 sample. So data were analyzed using SPSS version 27. Data cleaning, during the data cleaning, including coding, entry, and checking for missing data, I perform all those ones in the SPSS. Those are the process where the participant response that met the study requirements were selected. The Cronbach alpha procedure was performed to determine the survey selection bias and reliability, which is very common in the quantitative study, especially in this study, which is primary data, to be sure that the survey selection bias is at least reduced. So descriptive statistics characteristics of the sample were analyzed using the same SPSS version 27, and multiple binomial logistic regression statistics were conducted to determine relationship. The binomial logistic regression were analyzed, regression statistics, analyzed the dichotomous, variables. which means that I have to analyze the independent variable like out-of-pocket expenses and each dependent variable separately. That is binomial logistic, that is binary. Then in the multiple, I analyze the 3 independent variables of interest all together with each dependent variables. Next. So having conducted the analysis and all the assumptions because it's quantitative, all the assumptions in the regression analysis, the following findings were the most common one that are detected in the sorry. The following findings were the most common one that I was able to come up with. So it is very surprising. I figured that while controlling for the demographic and socioeconomics as in the previous studies, in other health studies, adult diagnosed with type 2 diabetes and prescribed medication spent an average of 115 monthly out-of-pocket expenses on 5 or more medications, which is surprising. However, the study also showed that health insurance status is significantly associated with purchasing medication over the internet. Having health insurance is 12 times more likely to purchase medication over the internet than being uninsured. And descriptively, among those who reported health insurance status in the study, 95% have one or more type of health insurance, and 3.4% have no insurance. So that's surprising anyway, because at the same time, they still have financial burden on medication, on their prescription medication. Also, while no significant effect in predicting the likelihood of obtaining free sample from a doctor or patient assistance program, that's another dependent variable. That's a separate. So, increased monthly out-of-pocket expenses, it's like 7%, and the number of prescribed medication at 17% increase the likelihood of obtaining free sample from a doctor or patient assistance program. So that's another surprising outcome. In addition, increased monthly number of out-of-pocket expenses and the number of prescribed medication are significantly associated with an increased likelihood of splitting pills or changing dosage frequency by 64% and 41% respectively. So those are the surprising findings. Next slide, please. Interpreting all this, I try to put all this all together in one interpretation that will probably summarize the whole goal and the objective of the study. That while most participants in this study reported being prescribed one or more medications and have used or are likely to use a cost-saving strategy with increased out-of-pocket expenses, being uninsured or underinsured is the primary reason among other prescription medication cost-related issues, with adults diagnosed with type 2 diabetes engaging in the use of cost-saving strategies. So these findings supported the belief that medical health insurance control the cost of healthcare services. Very important. Now, this study also has a lot of some limitations, especially in the area of the procedure and the participants. The non-probability one is that the non-probability nature of the survey administration, which is probably online and mTOG, reliant on self-reported information and study control for social, economic, and demographic, may limit the generalizability. In addition, the pressure on the mTOG members to answer without giving much thought to the survey questions and eagerness to earn more money from another study tax that paid more may also affect the findings of the study. The most important limitation that were across academic community or in this about this study is that the non-probability nature was a concern, because that might not accurately represent the that might not actually represent the actual type 2 diabetes population in the US. But I try to control for that in the data collection process. So this study, my recommendation is more, but I will just summarize it to that further studies are needed to consider the type of insurance coverage benefit, which means, though in this study, I collected data on the type of insurance, on the type of insurance which individual participants are. But it will be too much to combine it in the 4 dependent variables. At the same time, the analysis will be too much for this study, for this particular study, if I have to add that. So I recommend that the type of insurance coverage benefits that is affecting prescription medication costs among adults diagnosed with type 2 diabetes, reduce these health-threatening factors should be considered in the next study, which is my next study that I'll embark on, that I'm doing right now, because I already have all the data. Anyway, the social change implication of the study in a broadly explained manner is that the identifying predictors of alternative prescription cost-saving strategies by adults with type 2 diabetes may help promote personalized medication assistance for those patients experiencing financial hardship to ensure they remain in compliance with their medication. In addition, I will have to ask that the decision to use an alternative strategy may be a source for many patients to access affordable, consistent drug to manage medication compliance for their health condition. However, understanding the prevalence and association of these predictors, alternative medication cost-saving strategy, mostly the unpredictable source of prescription medication, because during the course of my study, I figured out that reporting the CMS claims report, even the pharmacy managers that is between, they don't have the data. they cannot reported the data on all this untraceable source that are investigated in this study. Even if they report the data, it's not in the CMS database. And okay, anyway, that's not my own comment. My comment based on my experience and the field experience and this. The reason for the cost of this prescription medication cost has to do with this data reported, self-data reported, because the CMS rely on most of the pharmaceutical industries that produce all these drugs. And that's why they were able to sell it online, because the CMS only rely on the data from the field in which they are regulated. So I can say that. So people do go out of those areas and purchase, use alternative medication strategies to get their medication in order to reduce cost. So identifying the predictors is very helpful to promote. It's even helpful in the policy area, because if health service practitioners and those that practice in the health behavioral field can understand the alternative source of medication, then it's this source as alternative source of medication it will be very helpful for the practitioner. It will be an opportunity to improve the health service access to prescription medication and shape policies and to lower prescription medication cost to benefit healthcare consumers. Next slide. For references. Yes. So thank you so much for listening. And at this point, I would like questions, and I welcome questions and answer.
Excellent. Thank you so much for your presentation. We do have a question here from Dr. Burchell. Who is the study most important to, and who needs to see your findings?
The study is more important in the broader perspective of those that are looking into healthcare cost and bringing down the healthcare cost, especially in the area of prescription medication. And the study is also good because the population that are used, which is type 2 diabetes patients that are struggling with the cost of their prescription medication, maybe access with all this barrier. So the study is very helpful for those population, and the practice, the behavioral practice, the behavioral and health service practice.
Excellent. And one more follow-up question. What was the most surprising thing about your findings?
Actually, the most surprising things about my finding is, number one, I was unable to, anyway, is about the study, the model, the study model. I'm trying to constrain time, so I don't want to talk too much about the behavior, the model that I use, okay, which is the reason action approach model. The reason action approach model as modified in this study is very unique. Because from the study, if you go back to can you please go back to the findings? So I want to explain one important, yes. In the study findings, I can see that increased monthly number of prescribed medication and out-of-pocket expenses is significant, with the likelihood of purchasing medication from other countries. But according to the model, it should increase the likelihood. It doesn't. It's with 37% reduction in the likelihood of purchasing medication from other countries, which is important in that. Though the reason that the variables of interest might not be the only reason for purchasing medication from other countries. So that might be another thing, that variable can explain that. But in addition, the model itself, the model that I use itself indicated that the data is in the direction of predicted. However, the mechanism of the model, though this is not the study is not to explain a theory, but at the same time, it's very surprising. I didn't even intend the study to explain a theory that can explain why people use alternative cost saving strategies, or that can explain the reduction, the reason, patient experience, or in a patient experience with their behavior using alternative cost saving strategies, or their behavior with prescription medication cost. But the findings really took me to that lane. Because if that is the case, which means there are other reasons that is not even in that in my study that is leading to this predictive healthcare costs, especially in the area of prescription medication. So I really find it useful that right now I'm trying to incorporate the model into practice. So having as a health service research analyst, or actually I try to move into the health financing side of the healthcare. But this model and this study really introduced something new into the care model.
Excellent, thank you. I have one last question for you before we close things out. My question is, what bit of advice would you give to other Walden students who are approaching this stage of their program?
Oh, but actually it's very interesting, and I will give advice for anyone who's approaching this kind of program to think about whatever he wants to do, what he likes to do, not what he wants to do, not as a study, a research study that's really that will really have a social implication, even in terms of knowledge, academics, and even in the field for humanities. Though in this study, I didn't consider socioeconomics and demographic. So, but notwithstanding, that has been evidence in the prescription medication for a long time. So those are the concentration area of the study. And it's very helpful in this study for me to come up with a program. What I will advise is that students, they should just do whatever they want to do. What's the study they want to do, try to come up with it, and and try to see what is a meaningful gap that will be helpful. And
Excellent.
we'll be able, and for continuity anyway. As
Wonderful.
a scholar practitioner, yeah, I'm sorry, thank you.
Thank you so much. Thank you again for sharing your experiences and your research with us today. Thank you.
Yeah. One last, do I have 1 more minute?
Yes, absolutely. Go ahead.
Oh, okay. Because this study was carried out in Walden. Actually, it's my pleasure, and I'm very, very, very happy to come up with this kind of study at Walden. So I really encourage others to go to Walden, and the support I got from my mentors. It's very, very, no, it's a rough road. It's very, very rough, because in the middle, I have to stop because they can't continue, because we can't continue. The study is too complicated. It's too complex. Then we have to come, and again, I have to restart again, that we have to streamline it to this level and this outcome. So I really appreciate that. And what I learned during the process is, in fact, very useful for my future in the academic right now. I have a lot, I've learned a lot, and I have a lot of perspective, a lot of studies, just during this course of research at Walden. So I can't even say. So I would like to add that to my comment.
Absolutely. Thank you so much.
You're welcome.